Good evening. Welcome in Daily UPSC audio program. My name is Times of India. Here is how to make India's health sector fighting fit. International trade trade has a carbon problem. The Hindu. Now the full editorial. My name is the Times of India. What name we are known by should be our choice. The challenging one's name is a fundamental right has been made crystal clear by the Allahabad High Court. Brief facts of the cases are after Sahnawaz legally changed his name to uh, Mohammad Shamir Rao and applied for this change in his school certificate too. The UP Education Board rejected his application, but the court found this rejection arbitrary and misdirected in law. It said that the name imparts a unique identity to each human being, and choosing changing it is a constitutionally protected freedom. Plus, there should be full coordination between central and state authorities on this. First, it is discriminatory when CBSE bylaws allows this while UP board doesn't. Second, after the school certificate, there shall be the matter of getting the name change for Aadhaar, ration card, voter ID, and DTC. Wives and celebrities, wives and celebrities have of course been doing this as a matter of course. Bachchan uh, was once Inqilab Srivastava, but rebranding of the self has become more doable, desirable, and democratized. In countries like China and South Korea, it is quite common to have different east and west facing names like Shi and Sthan, Wing and Winnie. In India, the trends include both eliminating caste and religion makers from one's new name and doubling down on such inheritance. Numerology is another popular motivation. Artwork of often left united to leave them more open for interpretation. But as artists of one our life, we human being seek more control of the numerous identities every individual inhabits. The name can only communicate a small part, but if this name feels inadequate, jarring, and painful, changing it has a big significance. Official bodies that so freely go about renaming places and institutions should not obstruct citizens' exercise of his right for the self. Here is how to make India's health sector fighting fit. Only if health is on the concurrent list can states tackle information asymmetry between service providers and and patients and regulate the healthcare sector. Indu Bhushan, the writer is chair partnership for impact and was founding CEO of National Health Authority. India faces a monumental task to ensure equitable and quality healthcare for all. On almost all health indicators, we rank last among G20 countries. Why this is so can be partly attributed to colonial influence. In particular, the Government of India Act of 1919 and 1935, which established health as a state subject. A reassessment helps understand the challenge that arose with health as a state subject. The India Act of 1919 granted provinces autonomy over health. The Act of 1935 demarcated subjects into federal, provincial, and concurrent lists, designating health as a provincial subject. The Indian Constitution retained health as a state subject. During the Constituent Assembly's debate on September 2, 1949, Hari Vishnu Kamath and Brajeshwar Prasad had opposed the inclusion of health on the state list. Kamath argued national health has declined under British rule and that government's goal should be to elevate it to A1 standard physically fit in all respect. Prasad believed health should be a union subject to protect the nation from diseases and epidemics, but the Assembly rejected the proposals. As a result, implications for the sector's financing, management, and regulation have been significant. For one, the constitutional structure hampers cohesive nationwide public health strategies. It restricts centers' ability to enforce a uniform standard and guidelines. Consequently, numerous distortions have risen, skewed infra unequal rules, unequal sector development makes for a stark contrast between states. UP and Bihar have some of the world's worst health indicators, while people's health in states such as Tamil Nadu and Kerala is comparable to that in upper middle income countries. The key difference is how much governments spend on health. The central health budget remained negligible since independence, stagnating at around 2% over several 5 years plan. As a constitution did not mandate an equal role for the center, the health infrastructure gap between states widened. Regulations were uneven. Government of India enacted the Clinical Establishment Act in 2010 as a registration and regulation framework to improve quality and protect partisans' rights, but it has largely been ineffective as states and UTs can choose to not adopt it. Healthcare industry's resistance has led to a handful of states implementing it, resulting in a patchwork of regulations and inconsistent oversight of clinical establishments. Similarly, state-level drug and device regulations have obstructed uniform drug regulations despite it being a separate entry on the concurrent list. The Drug and Cosmetics Act as a fragmented regulatory approach. The center makes rules for manufacture of drugs, but states grant the licenses. States have uneven regulatory oversight, variable drug quality, inconsistent standard enforcement, and insufficient protection from unsafe drugs. Unsafe drugs, centralized regulations, decentralized services. The Supreme Court mandated government implement the right to emergency and critical care regardless of people's ability to pay, but implementation is difficult. Rajasthan has passed a Right to Health Act that provides citizens free emergency care at public or private hospitals, access to medical records, and a grievance mechanism. Yet Rajasthan cannot achieve the objective of this legislation or its own. Rajasthanis live across the country. The state doesn't control hospitals outside its boundaries. Surely, such a basic right should be available to all, but individual states making such laws may not be the most efficient. A piecemeal approach by various states will lead to fragmentation and confusion. The right to health approach that holds private hospitals accountable may increase cost and lead to potential relocation of private hospitals to states where their obligations with respect to emergency care are weaker. Uniform definitions of emergency care and role of hospitals countrywide is thus essential, decided by the center. Over 75 years, advances in the technology and innovative approaches, the dominant role of private sector, increased reliance on third-party healthcare payment system, and emergence of digital health have reshaped the industry. With a mobile population seeking services beyond on state and growing information asymmetry between service provider and patients, it is un, unfeasible for states to manage and regulate health services. The 15th Finance Commission also recommended health to be transferred to the concurrent list, allowing for uniform policy formulation and implementation. This change would empower the center to establish nationwide standard while preserving state autonomy to tailor policies. Changing the constitutional framework will not address the big challenge on its own, but will make it easier for governments to do so. International trade has a carbon problem. The Hindu environmental protection should not become a smoke screen for trade protectionism. Prabhas Ranjan teaches at the South Asia University and Shantanu Singh is an LLM candidate at the Geneva Graduate Institute. The European Union's key climate law, the Carbon Border uh, Adjustment Mechanism (CBAM), has spooked India. New Delhi fears that CBAM will cripple the export of its carbon incentive products to the EU, while India's export may be limited to aluminium, iron, and steel and affect only 1.8% of its total export to EU. India has reportedly de- decried CBAM as being protectionist and discriminatory. There is also talk of challenging the CBAM as the World Trade Organization's WTO's dispute settlement body. This debate brings to the forefront the interlinkages between trade and the environment. While the international trade regime allows countries to adopt unilateral measures for safeguarding the environment, environmental protection should not become a smoke screen to trade protectionism. The CBAM needs to be viewed from this standpoint. About CBAM in 2005, the EU adopted an important climate change policy known as the Emissions Trading System (ETS). Now is in fourth stage. The ETS is a market-based mechanism that aims at reducing greenhouse gas (GHG) emissions by allowing bodies emitting CHGs to buy and sell these emissions amongst themselves. However, the EU's concern is that while it has a mechanism for its domestic industries, emissions embedded in products imports from other countries may not be priced in a similar way due to a lack of stringent policies or due to less stringent policies in those countries. This the EU worries would put it industries at a disadvantage. To tackle this, the impacted industries in the EU had so far been receiving free allowances or permits under the ETS. Furthermore, the EU also apprehended the phenomena of carbon leakage that is due to the application of ETS. European firms operating in carbon intensive sectors might possibly shift to those countries that have less stringent GHG emission norms. CBAM is aimed at addressing this quagmire and thus leveling the playing field for the EU industries. Under the CBAM, imports of certain carbon intensive products, namely cement, iron and steel, electricity, fertilizers, aluminum and hydrogen, will have to bear the same economic cost borne by the EU producers under the ETS. The price to be paid will be linked to the weekly average of the emissions price under the ETS. However, where a carbon price has been explicitly paid for the imported products in their country of origin, or reduction can be claimed. WTO consistency, a cornerstone principle of WTO law is non-discrimination. Thus, countries are required to accord equal treatment to like products irrespective of the country of origin, most of favored nation treatment, and to treat foreign made like products as they treat domestic ones. National treatment principle. While the CBAM's design is origin neutral in appearance, it may in its application discriminate between goods and different countries on account of an inadequate pricing policy or due to onerous reporting requirements that imports would be subject to. A key consideration in all this may be whether the carbon intensive products to which the CBAM applies are like wheel steel products may appear similar. The process by which electric arcs furnaces produce steel is less carbon intensive than the steel produced is blast furnaces, for instance, uh, being products that are not like the rules on non-discrimination would have little application in such a case. Accordingly, the debate on CBAM uh, regenerates a long-standing debates in international trade law circles. Must processes and production methods be relevant for comparing products. Traditionally, the answer to that in WTO jurisprudence has been no, and on that account, as commentators have noted, the CBAM violates WTO law for discriminating between EU and foreign products covered by CBAM based on the embedded emissions. However, even if the EU CBAM is discriminatory, there could be a claim for justifying it under the general exception clause in the article X XX of the general agreement on tariff and trade, GATT. Under the article XX, measures taken by countries that otherwise violate GATT obligations are permitted if first they fall under one of the listed policy ground, and second if they satisfy the requirement of the introductory clause of article XX, known as the CHAPU. One of the listed policy ground in Article XX is conservation of exhaustible natural resources. CBAM would fall under this category. However, it is doubtful if it would satisfy the CHAPU, with inter alia requires that countries do not apply measure in a manner that results in arbitrary or justifiable discrimination between countries where the same condition prevail. As commentators argue, the CBAM only considers explicit carbon prices, not implicit cost, non price based cost borne by products originating in certain countries. Accordingly, it arbitrarily or unjustifiably discriminates between countries where the same environmental conditions exist. Finally, CBAM is also an important issue in the ongoing India-UE free trade agreement negotiations. India should work with the EU to secure gains on CBAM and ensure smooth onboarding for India exporters to maximize the benefit of a bilateral deal, even as the possibility of the WTO challenge remains open. Thank you.